me?
Yeah.
Maybe I'll stand. So, what I should say is there are very few cities that have anything like the Smart Chicago Collaborative. They're a national model, I think, for how technology can improve civic life. So I'm really glad to be here, and what Dan and Chris and now Sonia are up to, I think, is really important. And it's made manifest by what a rock star group you guys are. And that leads me to an admission, I have to say, which is that the $2.2 million that we and Robert Wood Johnson Foundation and California Healthcare Foundation are offering is a sort of a ruse, right? I mean, it's real money, and we're going to invest in a set of projects. But really, the real value that we provide is bringing together groups like this. We're doing it 21 times across the country. We're doing it at newschallenge.org as in virtual space. It's an opportunity for us to learn, and it's an opportunity to kind of hopefully provoke some interactions that you had a little bit before we started. Hopefully we'll switch it over to you guys soon so we can have it here, and hopefully that'll be extended. So I'll talk for a little bit about the frame of the contest, what Knight Foundation does, but obviously it goes without saying, the value is what you guys are up to. So not unlike Dan, Knight Foundation does not do, we're not a health funder, we're certainly not a healthcare funder, right? We do two things pretty well, I think, and our passion and history lie in two areas. Journalism, which the journalism nerds in the room know first and foremost, and community. And Dan touched on the community aspect of things. So historically, we've been the main funder of journalism education, journalism training, with notable partners like the McCormick Foundation over the years. About 2006, 2007, our leadership realized that there were fundamental changes happening within journalism, and that rather than continue to fund the same programs, we needed to jumpstart our thinking, jumpstart our networks, and try to look around the corner a little bit. The main vehicle we've had for doing that is the Knight News Challenge. Every Block, which Dan was part of founding, was part of the first iteration, the first $1 million around that. We've since invested in about 100 projects for the total of around 30 million, a little more than $30 million since then. And learned a lot, which I can touch on later, about what does and does not work when it comes to creating projects that serve the information needs of people living in a community. And the community part is a really important aspect for us, and it dates back to the fact that the Knight brothers owned newspapers in cities across the country, that they fundamentally believed in the importance of news and information. I'm going to come back to information in a second, for feeding a democracy, right? And as we've wrestled with over the years, the changes in the way journalism is conducted, which many of you have been a part of and experienced, challenges us to come up with new ways of making sure that citizens are participating and have access to the information they need. Our community work is rooted in 8 cities across the U.S. and works deeply in another 18. The work that we do on the journalism side is international. So the key question, and Chris, maybe can you pull up the screen again? At newschallenge.org, or you can do your email if you want. Mail is available for pickup. That's the best subject line I've ever seen.
That's every freaking day we get that email.
That's meta. You get an email saying you can get your mail.
Yeah.
So the question we're asking is how. Yeah. You can hack. The proposal could be to hack that. How can we harness data and information for the health of communities? That's the question we're asking. That's basically the application, is answering that question. And I can tell you more about that. But let me just unpack that a little bit. So I said that we're not a health funder. We are a news and information funder. Over the course of running the news challenges over the last few years, and in particular the most recent news challenge on open government, the open government one was one of the first deep themes that we did. One of the things we found is that, with a couple of exceptions of you around the room, open government probably a fairly abstract term, right? And if I asked you for a definition, even someone like Michelle, who works in government and is involved with pushing it out, I mean, could you give me a definition of open government?
Making government more transparent by making data available in other documents.
And that's a hard, I mean, even that definition, which is cohesive and is hard for normal people, I think. It's proverbially, it's hard for my mom to sort of get her head around exactly what that means. One of the things, as we thought about the next topic, was we realized health data and information, for all the reasons that Dan outlined, is vital for all of us, right? It's vital for our own personal lives. It's vital for how we live in community. It's vital for our families. It has a tangibility to it that we didn't already have. We're lucky also, as not being healthcare funders, is that we're able to identify and work with and design the challenge in conjunction with a set of partners like Robert Wood Johnson, like California Healthcare Foundation, like Clinton Foundation, like the Health Data Consortium. So all those partners have been involved in designing the challenge, are going to help us do the evaluation, are going to help us select the winners. And actually a couple of them, they've each, Robert Wood Johnson and Clinton in California Healthcare have put up $100,000 for the projects that best serve a couple of questions that they've asked, which I'll touch on at the end. So I touched, so again, going back to the key question, right? How can we harness data and information for the health of communities? So that's health. Data and information, I want to unpack a little bit. There was a quote, a guy named, a data scientist named Laszlo Block had a quote this week in the LA Times talking about data, and he framed it as saying, you know, for a lot of people, data is this scary concept. It represents robots, and it means big data, and it means some big IBM mainframe down in the basement. And really what data means is facts, right? And so while we have a fairly specific topic area in mind for the news challenge, we're casting a wide net, and we want people to tell us what data and information for improving health means. So let me touch really briefly. So the question that I think might be relevant for a couple of you in the room that I just want to flag from California Healthcare Foundation is how to use data to help county and city level officials make good policy. That's something that they're very focused on. So I'm going to wrap up for a second. And the Robert Wood Johnson question is, how can we better link and use public data with private healthcare data? So both those, so the main question is just the general question of data and information. These are two bonus kind of cherry on top sets of funds that you can win. The contest is open. It opened Tuesday. It runs until September 17th. Between now and September 17th, it doesn't look like the type of grant application that you might imagine for those of you who've, like Jennifer, who've been in the world of sending grant applications to us in the past. It's a live iterative document. You can upload videos and photos. And actually, why don't I shut up? Can you go back to the video? And we can just show the video that gives you a sense of what the application process is about. And then I'll say one more thing.